Tonight, Unprotected, our continuing Five on Your Side investigation uncovering caregivers stealing from those who trusted them and revealing a broken system of oversight and regulation.
Five on Your Side Chief Investigator Ron Regan joins us live in the studio tonight. And Ron, you've got a one-on-one interview from behind prison walls that's riveting.
Well, these interviews are rare. I spoke with a caregiver who admits she stole a fortune from the family that trusted her. Even more alarming, those being hired get little regulation or oversight.
I got to a point where I didn't care anymore.
Michelle Baker
I didn't know how to stop.
is now serving 7 years in prison.
I took advantage of his kindness.
She was a home health care worker.
Why did you do it?
I was going through a lot.
Instead, prosecutors say she's a thief, stealing more than $200,000.
She totally took over their finances. And when she took over those finances, she ended up embezzling virtually all of their money.
What did you do with all that money?
Sat in the casino for days.
In a casino?
Mm-hmm. In a casino.
Gambling away?
Gambling away.
Tens of thousands of dollars?
Yes.
From a man who trusted you?
Yes, absolutely, I did. I did.
And in Ohio, it's easy. Our investigation found a broken system of oversight and regulation.
I am struck by how much of this goes on.
There's a lot of it. I mean, just being in the medical field for so long.
There's a lot of it.
There's a lot of it, absolutely.
Is this happening more and more?
Absolutely. This is becoming a bigger problem. There's an aging population.
In Ohio, the 6th largest population over 65 in the nation, 1.8 million and growing. And so are home health care workers, 94,000 across Ohio, up 52% in just the last 10 years. So we wanted to know who's coming into your loved one's home.
I don't need to be licensed. I don't need to be certified. I don't need any specific training. Is all that true?
Yes, you do not need to, for non-skilled care, you do not need any specialized training, certification, or anything like that to be able to provide care. Now,
Joe Russell should know. He heads up the largest association of home health care agencies in Ohio.
it is as easy as just simply opening up a business and
Hanging up a sign,
hiring
hiring
saying,
a few people off the street.
and here's the services we're gonna provide, and then go out there and start marketing yourself.
That's why Russell is calling for increased standards and oversight.
The question really becomes is, what should we be doing to look at those agencies to ensure that they're not crooks, to ensure that they're not gonna steal from these folks?
And we found even when families repeatedly complain to Adult Protective Services, the agency that's supposed to protect often fails to act. In one case, this woman was finally charged with stealing more than $600,000 from those she was caring for.
I'd like to ask you some questions about the charges against you, please.
And another, this time with a criminal history of theft, was ultimately charged with fleecing another victim's life savings.
These are serious charges. You're actually charged with fleecing.
Get out of here.
We have some questions.
Why don't you ask daughter in the
Did you fleece his life savings?
But even if convicted, Adult Protective Services in Ohio failed to track them.
In terms of protecting the public, absolutely, there's a lot of value in creating a registry to identify some of the bad actors that are out there.
Michelle Baker has accepted responsibility for what she did
I still know right from wrong. And what I did was very wrong.
and has a warning for families.
They need to be involved, first and foremost. Family, guardians, power of attorneys, they need to be involved. You can't just allow people to be there and just do what they're doing without knowing what they're actually doing.
And we found something else. If you hire a home health aide that caters strictly to private pay clients without Medicare or Medicaid, no one is checking on who's being hired or how they're performing on the job. I'm Chief Investigator Ron Regan.